Well, I'm Rod Hochman, the CEO at Swedish. This is truly a great day. There's very few times in your career you get to birth one of these things. And for this community and for the state, this is truly a remarkable day. When you come out here, some of you might see a flat, barren area with one building, and I see a vibrant medical community here. What we're trying to build here is a medical community for the next 30 or 40 years for Washington and for this community. And taking in mind, there are two topics that are on everyone's mind in the country: healthcare and jobs. And what this helps solve are healthcare and jobs. So if you want to get two things hitting both of those, this is great for the state, it's great for the community, and it's great for everyone in Washington. We look at this as something that will help grow this area, that will provide for the state-of-the-art clinicians, and really provide what healthcare should look like as we move into the future. We're lucky enough here in the state of Washington to have a great governor. And it hasn't necessarily, I can really relate, these last couple of years haven't been easy for anyone leading. The country melted down last year. All of a sudden, those resources that we thought we had, we don't have. But there's one great thing. When you have great leadership that we have in the state of Washington, we have someone that's really going to turn and get this state going in the right direction and isn't afraid to make the tough decisions and do what needs to be done. So we are very, very lucky and honored to have our great governor, Chris Gregoire, here today to speak with us. Thank you.
Well, thank you, Rod. It's a pleasure for me to join all of you dignitaries, all you members of the community in what is a big day of celebration. Now, Rod said it, so I just got to say, it's not every day you get some decent news now as governor of any state in the country. So while we're here for a big celebration, and thank goodness, I just want to take a moment to celebrate that the Dogs won on Saturday and the Seahawks won on Sunday. My husband and I were returning home Saturday night and listening on the radio. Little did we understand that interception was that ball coming off that guy's foot and into our, we got messed over at Notre Dame. We deserved that chance. And yesterday, when we thought we were down and out, back he comes with those broken ribs and shows the rest of the country, don't count us out. We're ready for the Super Bowl again, only this time we're going to win the dadgum thing. So anyway, got to celebrate today, got to celebrate the last couple of days for football. I want to congratulate Swedish Medical Group for this amazing day and for stepping up and meeting the needs of the community. I don't know how many of you realize that this is the only community of its size in Western Washington without a hospital. So if we continued with the growth that we will in this area, imagine what it would do for the people here who are in need of those services, having to travel. So Swedish saw the needs of the community and stepped up and said, we've got an answer and we're going to do it right. The up to 175-bed hospital will include the latest advancements in design as well as technology. It's going to invest in a paperless campus, cutting down on administrative work. Now, those of us who go to an emergency room, who are able to communicate with personnel, is one thing. But if we end up in an emergency room and we're not able to communicate and we don't have someone there with us, you can bet it's a hit and miss in terms of the quality of the services that we will get. When we have electronic medical records like what we will have here, we can guarantee good, high-quality services will be delivered to the patients who come into that emergency room. This is state-of-the-art. It's as it should be everywhere in the country. Bedside communications will be the very best anywhere. The design is also very advanced. By engaging with our local communities here and thinking about the entire medical experience, they've crafted a new area here that will serve as a medical commons. Medical commons, by the way, as I stopped over at this one building over here and thought to myself, my word, they're lonely, they need a little company. Imagine how amazing this whole area will be as the community needs and deserves the services it will find here. And I can't tell you, Rod, how happy I am that you're going to use the greenest of building standards. You're going to be a model, as this beautiful area needs and deserves, but this community embraces with its love of salmon and understands what it takes to really embrace salmon in its future. Along with the emergency care and surgery, the campus will include, of course, the physician offices, outpatient surgery, a pharmacy, and oncology services. So residents here will have both acute and preventive care. You saw the community and what it needed here, and you addressed it. I want to stop because Rod introduced the subject and talk for a moment about what's happening nationally. This hospital cannot go by way of every other hospital in this state and across this nation, where all too often it is the choice of those who have no care to come to get routine medical care, the results of which the cost to the hospital is huge. We need to find a way to resolve that. We can no longer endure a medical crisis in America. It is time for us to stand up as a country, stop the divisiveness that I see in Washington, D.C., and understand it is time to do what Swedish and this community is doing, which is saying we need affordable, accessible, high-quality health care for all the members of this community, this state, and this nation. Hospitals do struggle around the country with the current system. As I look at our basic health plan, a plan that is not funded by any outside money, totally funded by state and the contributions by its members, we have 63,000 people who are sitting waiting while we are cutting people off that program for lack of ability to fund it. By the way, the costs for the uninsured are one thing, but we all know the underinsured are significant all across the state and across the nation. We have seen far too many of our businesses, our families, and our governments struggle with the escalating costs of health insurance at an economic time that is the worst it's been in 70 years. Yet, we know how to do it. Swedish comes here with the exact way in which it should be done. We need to make sure that everyone has access to good, high-quality care. And we need to make sure that it's not the choice of those who need preventive or routine care to come into an emergency room. We too can go paperless. We can use electronic medical records to drive up quality and drive down costs. And like you, we need to rethink the overall design. We have a system in America today that is upside down. We pay for treatments and procedures with little regard to the outcome for the patient. It's time for us to start understanding it's not about visits to the doctor, it's about outcomes to the patient. That's what Washington State has been trying to do. I've been in contact with our delegation. I've met with President Obama and his healthcare team. I've met with Senator Baucus, and we have about monthly calls with him and the gang of 6 on the Senate side. We meet often now with Speaker Pelosi. A small group of governors are now leading the nation's governors to say this is not about politics, this is not about partisanship, this is about America and its needs to have healthcare reform and healthcare reform now. We are a leader in these fields in Washington State. From our innovative basic health plan, which Senator Cantwell is trying to introduce as an option across the country, to those ideas in which we pilot electronic medical records across the state, and we pilot high-quality health care and outcomes as the basis for payment by the state. So this project is exactly what America needs. This is the kind of healthcare reform we ought to see all across the country. So those who are back in D.C., dividing themselves along political and partisan lines, I say come visit us in Washington State. Come take a look at what we've got, well, not today, but 11 and 12. Come see what we have in Washington State. That's what we ought to have everywhere across the country. If we could make that happen, we would resolve the healthcare crisis in America. We would lead among the world. We would have people no longer afraid of tomorrow being a diagnosis away from bankruptcy, businesses that can afford to pay for the health care of their workers, and governments that can continue to invest in high priorities like education rather than the escalating costs in health care. That's really, when I come today, what I came for, to say thank you to the leadership at Swedish. Thank you to what you're doing in this community. This is a model for America. I've come to join you in this celebration, digging a little dirt in the hopes that we can cut a little ribbon in the future and have the kind of success we all came to see. Thank you all very much, and congratulations.